I am part of the American Academy of Periodontology and American Board of Periodontology. That's a fancy way of saying I work with a bunch of dentists who are experts in gum health. I started ToothHQ Dental Specialist. As you know, we have 4 offices in the Dallas-Fort Worth area. We are all about making sure your teeth and gums are healthy and strong. Now, I'm here for you. I would love to hear any questions you might have about your teeth and gums. You can ask your questions live right now or even send them in for our next show. Your questions help us make these shows really helpful for not just you, for everyone. And one more thing, if you really like what you're learning here, and please let us know. Your feedback is super important to us. Don't forget to like and subscribe to our live channel so you won't miss out on our latest updates and helpful tips for your dental health. So I'm so looking forward to talking with you all and answering questions, and let make our smiles as best they can be, right?
Absolutely.
Yeah.
Okay, and I know you guys are super excited, so we'll jump straight in. First question. Hello, doctor. I'm 40 and a few of my teeth are loose. My dentist recommend laser gum cleaning. Can this fully replace traditional cleaning, or will I still need annual cleanings and laser treatments?
So whether the teeth are loose because of the periodontal disease or something else going on, and that will determine whether you're going to need like a regular cleaning or laser cleaning or a combination, and whether you're going to need annual cleanings after a laser treatment, or whether you're going to need continual laser treatment, really depends on what you got going on. If it is truly the teeth are being loose because of what we call it as a periodontal disease or gum disease, laser treatment may need to be repeated, regular cleanings may need to be repeated, and the deep cleanings or the deep gum therapy or even the gum surgery may need to be repeated. So the best thing is, wherever you are, talk to your dentist or the periodontist or your gum surgeon, and they should be able to help you.
Absolutely, definitely. And we would love to do your cleaning, so come see us.
Absolutely. If you're in Dallas Fort Worth, come see us. We can help you.
Surely can. Next question. My teenage daughter has special needs, making oral hygiene a challenge. She already has had 2 root canals, and dental treatments are very difficult for her. Could you guide me on improving her oral hygiene?
So, oral hygiene, it is a difficult thing even for regular people. It is one of the common things that I say. Last night, Shai and I, we were teaching a group of dentists at a class last night. So we were just talking about, hey, depending on what kind of question that you get, what kind of question you ask, then the response you're going to get. So I normally ask patients, and hey, how's the brushing and flossing going? And then they'll say, great. And then that's what most of the patients will say. So in the last several years, I started rephrasing my question, asking, hey, how's the brushing and flossing going? And are you doing well? Or are you cheating a little bit like most of our patients do? And then some patients, or most patients, or at least half the patients, well, I'm cheating here and there, right? So again, going back to your question, so if the dental health or keeping your oral health is hard for the regular people, then for the kids with special needs, it's going to be even harder. So combination of things, simple routine. And if your special need kids is refusing to brush their teeth, or if they need a little bit of help, so you probably need to help with them. And special tools and regular manual toothbrushing may not be sufficient. You will probably need to get what we call it as an electric toothbrush or a motorized toothbrush, a water picking, and it may be an additional help you may need. Water flossing or air flossing, those are helpful tools to have. And make sure that one of the biggest things is, if you are not able to keep your mouth clean, you may end up getting your kid may end up getting cavities. So make sure that you're using toothpaste with fluoride, And then a lot of things that you will be able to see. Some of the apps that we have on the electric toothbrushes. If your special needs kids is fond of gadgets, and then give them a toothbrush with an app attached to that, so they may be actually watching what they are doing on their smartphone. So while they're doing that, and more than anything else, and I normally say this even for the healthy adults. Hey, if you're not fond of brushing and flossing, and don't delay your dental visits, not make it more than 3 months or 6 months. If you We recommend for somebody with gum health, you come see us every 3 months. And if you're not able to come every 3 months, it is going to affect your teeth. But for special need kids, you even recommend you come every 2 months. So a bunch of things you can do. That's pretty much the bottom line.
Absolutely. And we all love a cheat day, so don't feel too bad.
Yeah, that's right. Thank you. Yeah.
Absolutely. I am 32 and I have a long history of migraines. Could dental issues be connected to migraines? Are there specific dental problems that might trigger or worsen symptoms? And are there any treatments that could help?
So the migraine is one of the most common things, and either we start with the migraine and then we do some dental treatment, and then if the migraine is still not resolved, then we send them to a physician or a neurophysician or multiple other physicians that we work with, or we get people from the other way around. Oh, they had a chronic headache and they have seen multiple physicians before, multiple neurophysicians and neurologists, and they couldn't find anything. And then now the physician tells us or tells the patient, oh, you need to go see the dentist. And guess what? We find out later then they are grinding their teeth, and their teeth are completely ground down. You can't even see some of the teeth are, their teeth are kind of really, really short. And they have a lot of jaw popping and then jaw clicking. They hardly can open their mouth wide, and sometimes when they open, the jaw kind of goes to one of the side. So there are multiple things that as dentists we are able to see whether people have problems associated with the joint or associated with the teeth that could be triggering the migraine or unexplained headache or anything. So if you have unexplained headache or chronic migraines, go see a dentist and they should be able to help you.
Absolutely. Our next question is, hello doctor, what causes peeling on the roof of the mouth?
Multiple things can cause peeling on the roof of the mouth. We saw a patient a couple of weeks here. The patient was using a toothpaste like that they have recently bought it from just online, because somebody from Instagram they had acquainted with, they told them, oh, this toothpaste is good. Well, not all toothpaste may be good for every single people. We all have sensitivity, and you may have, your skin may be sensitive to one type of soap, for example, or one type of lotion, for example. The same way, your gums or your mouth may be sensitive to one specific toothpaste. So make sure that you're not using the toothpaste that you may be sensitive to, and the allergic reaction may be because of the toothpaste or maybe some of the other materials that you may be using. If you're starting to use a chewing gum, or you may be using a different type of mouthwash that you may be using, or it's sometimes related to dentures you may be wearing. You may not be thinking that it may be rubbing either on the gum or rubbing on the cheek, or you may even have a filling, or you may have a crown that may be rubbing or peeling on the cheek, and that could be causing as well. And then you may even have a tooth that's broken and that is like really feeling sharp. That could be rubbing on the cheek or the gums. It could be causing some damage. And we very routinely see that particularly when you have a broken tooth or a broken filling, it rubs on your tongue. It causes peeling of your tongue, or even causes ulcer on your tongue. So variety of things could be causing this peeling or the ulcers in the roof of the gums. So go see a dentist and they should be able to help you.
All right, absolutely. We'll keep it going. I'm 18 and having issues with my lower right wisdom tooth. My dentist suggested removing all four. Since only one side bothers me, would it be better to remove one side first? Could you explain the pros and cons of removing all four at once versus in stages? Oh, over to me.
Yeah.
Okay, so we definitely recommend removing all four for a variety of reasons. One being that when you remove one tooth, if you don't have something to oppose it, the other teeth start to move either up or down, which could adjust your bite or make it complicated to eat or anything of the sort, even shutting your mouth. So we definitely would recommend you moving them all four. Not only that, you have to heal. So the pro would be healing all at once rather than having to take certain stages.
What is that?
Oh, IV sedation.
Yeah.
That's another option. So just for the comfort, we do IV sedation a majority of our patients to ensure that we get them in and out, and for them it feels like a dream that is maybe lasting 5 minutes. So definitely it's more comfortable to do it all at once.
And particularly when you're being put to sleep, right? So
Yes.
you don't have to go through this over and over again.
Yes, and be cognitive of what's going on.
See, you answered your own question here.
I did.
Right? There we go, man.
did.
Yeah.
Perfect. Well, that one was sweet. I have a root canal appointment soon, but I've been vomiting for 2 days. Should I still go, or would it be better to reschedule? Could my vomiting be related to my dental issues?
Definitely, the vomiting can be related to your dental issues, particularly if you have a severe infection, and or you may have, like we see very routinely, patients come in here, they can't even think well, and they are in constant pain. They have pus pouring out, like a pus pocket. It is continuously pouring into the mouth. Imagine that when the pus pours into into your mouth, in the back of the throat, that definitely could be causing a lot of nausea, vomiting, and I feel like you're going gross here, right?
Yeah. 100%.
Yeah, right. So imagine like pus pouring into that. Imagine what I mean by pus is like, imagine you have a pimple on your face and then you squeeze it and you have that greeny, whitish green stuff coming out of that, and that's exactly what is happening. Imagine you got pot load of that got stuck under the gum or around the gum. Now it is pouring into the mouth. And a lot of times, you guys may not see this. What happens is when the infection gets stuck under the tooth, when we remove the tooth, and we will see the pus gushing out like that. So imagine if that gets into your throat and goes into your mouth, that is definitely going to make you feel nauseated and vomiting. So if you have vomiting because of that, it is completely okay for you to go through the treatment, because that is relieving the infection and taking out that pus is the only thing going to make you feel better. Otherwise, if you're very sure, like if it is just maybe a little bit of an ache that you're dealing with, or you may think that you may have some discomfort from a filling or a crown or like a small dental problem, and if you feel the nausea is related to maybe a recent sickness that you have had, then it is okay for you to postpone the treatment. And again, the best thing would be either you talk to your dentist or see a physician to see what condition your body is in, and then make a decision whether it is right for you to proceed with the dental treatment or not.
Absolutely. So I definitely wouldn't let it sit, okay? Definitely visit your nearest physician or come see us. We'll definitely help you out. I'm looking for a dental insurance plan with flexibility to visit both in-network and out-of-network dentists. What type would be best?
If you're particularly looking for a plan that gives you the freedom to anybody you want to go, the best one we recommend is
PPO.
There we go. Right. So the PPO plan is the one that we recommend. So within the PPO plan, there are multiple ones that they have available. So particularly when you are, this is the end of the year coming. So definitely when you are talking to your HR department or whoever you are talking to get the plan of your choice, make sure that you are going to pick a PPO plan that is going to give you the freedom to go to either in-network dentist or the out-of-network dentist. So the best plan is the PPO plan. Any other plan such as HMO plan or any other plan that does not give you the flexibility, the HR or the agent that you are going to should be able to answer your question.
Absolutely. Definitely ask those necessary questions. Am I able to, get out of network benefits? That's definitely what you want to ask when you're shopping.
And more than just the outer network benefit, and you want to go to a dentist that you feel comfortable with,
Oh, yeah,
right?
that you prefer. Absolutely.
Yeah, so that's
definitely.
very, very critical. Yeah.
Mm-hmm. Absolutely. Hello, Dr. V. Could you suggest foods? Oh, this one knows you.
Yeah.
Could you suggest foods that supports gum health and help improve gum disease? Any dietary recommendations for healthier gums would be appreciated.
See, I'm popular.
You're popular.
You asked me
You're a
the
known
question.
guy.
Yeah. There we go. Right. Okay. What food is good for gum health? Right. So many things that can make your gums healthy. Vitamin C, as you guys know, it's very good for your gum health. Leafy green vegetables, and so whenever you're eating vegetables and it's the fiber, that's going to help you keep your gums healthy and particularly get the plaque out of the way. So when you get plaque out of the way, that is going to be very healthy for your gums. Also, dairy products that are rich in calcium and phosphates, and those are really good also. Crunchy food and crunchy vegetables and crunchy fruits again when you're crunching that, not the chips, okay, the crunchy fruits, right? Not like a lot of carb. So when you crunch them, that's just going to get the plaque out of the way or the food out of the way from your teeth, and those are really good as well. Green tea, and green tea has like a lot of antioxidants, and then that will help you reduce the gum, the bacteria or the bad bacteria in your mouth. Nuts and seeds, and they offer a lot of vitamin E to support your gum tissue health. We already talked about vitamin C, which is really good for your gums also. And then of course water. Water is one of the best medicines you can have. You can keep your mouth hydrated when your mouth is healthy, and when you're hydrated, you're going to prevent the cavities, and that's just going to help. And then avoid the acidic and sugary food, which is not good for your teeth, not good for your gums either, because that is going to attract the bacteria and start killing your teeth and your gum. So lots of options you have.
Absolutely. And I mean, good for your teeth, good for your overall health. So definitely just be mindful in what you're intaking. It's time for a game, Doctor.
For
rapid fire.
Oh,
yeah,
okay.
Our favorite part.
Mm-hmm.
Let's go. Okay, so you guys, for this segment, Dr. V has to answer a question in like less than 30 seconds, in between 1 to 2 sentences, okay?
Okay, man, I'll
Short
try.
and sweet. Yes.
Okay, man, I'll try.
Here we go. I've used whitening strips before and got small white spots from fluorescence. Fluorescence. Is there a home whitening option that won't cause these, or should I see a dentist?
The best thing is I recommend that you consult a dentist, and there are a lot of whitening options that you have available that will minimize the white spots, and including the fluorosis.
Thank you, doctor, for that correction.
Yeah.
Fluorosis, you guys.
Fluorosis, yeah.
Perfect. Okay, short and sweet. Can my 8-year-old son use adult toothpaste?
Absolutely. Your 8-year-old son can use the adult toothpaste, but make it a smaller portion, maybe like a 1 pea sized or 2 pea size, so that's just going to fit his age.
Perfect. How much gum, xylitol, can I chew a day?
As minimal as you can. I recommend maybe once or twice, because it's just not the xylitol. Of course, you by chewing 1 or 2, you may not exceed the xylitol maximum per day, but what you may end up doing is by continue chewing, you'll end up damaging your joints. That's why I don't recommend doing that.
Perfect. Dr. V, as a lactating mother, is it safe for me to undergo laser teeth whitening?
Absolutely, it is safe for you to undergo laser whitening, or particularly if you have any gum disease that you're dealing with, you may need some laser gum therapy. So it is absolutely safe for you to undergo laser when you're pregnant or as a lactating mother.
Very good question. And what are some good teeth-friendly alternatives to carbonated drinks?
Um, Multiple things: water, herbal tea. We talked about it earlier: coconut water, infused water, and or water with some fruits, and maybe you can put some fruits in them. Um, no lemon, no sugary foods, or no carbonated drinks. Anything other than that, anything natural is good.
Wonderful.
No
Okay.
sugar. I think we said that, right?
hmm
All
You
right.
did well.
Oh,
Yeah, you kept it short and sweet.
thank you for the compliment, man.
Absolutely.
Yeah.
Okay. So, we'll get back into our questions. I have gum disease but no cavities. Do I still need fluoride toothpaste or does fluoride help with gum disease?
So, fluoride absolutely helps with preventing the cavities, and there is a huge debate on fluoride is good for your health, or sometimes people have this debate always. Fluoride causes brain damage, fluoride causes this, and fluoride causes that. Anything in medicine we can debate good or bad. So far, what we believe in dentistry is fluoride is absolutely good for your health, whether you have gum disease or whether you have cavities or not. It doesn't matter. Fluoride is absolutely good for your teeth, and I recommend you use a toothpaste with fluoride.
Absolutely. Hi, ToothHQ. Hello. Thank you for referencing all of us.
Yeah.
Are there any financing options available for gum disease treatments? Yes, especially here. Okay, we have over 5 different type of payment plans that we can offer you, including discounts. Oh, we have a brochure. Dun,
Yeah.
dun, dun, dun.
So, one of the most common questions, and just like this caller is asking, what they are saying is, or they may be concerned about is, oh, either they might have heard that I went to a dental office and they offered a certain type of an option, payment option, I did not get qualified for. So that is one of the reasons they may be. I'm thinking you are probably asking. So what we do in our office is depending on their comfort zone, or depending on their credit score, or the multitude of things that we will have to consider. We go to multiple different banks to offer the payment plan of your choice. So as Shai said here, we got about 5 or 6 different options: Care
That's right.
Credit, Lending Club, Cherry, Basis, and we have Moment, and we have
Proceed.
what is it, Proceed. Yeah, so there are multiple options, and I'm just naming maybe out of 5 or 6 of the 20 or 25 different options that are available in dentistry. So talk to your dentist and wherever you are, and they should be able to help you.
Absolutely. Or come see us.
Absolutely, if you're in the Dallas Fort Worth area, so we got 5 or 6 different options we can help.
That's right. So on the next one, I'm 54 and I lost my back teeth 10 years ago. Now my front teeth are loosening. My dentist recommended all-on-4 implants over traditional ones. Could you explain the difference?
So you're asking about the dental implants versus the all-on-4. All-on-4 is a fancy way of saying, or a newer way of saying things, or a newer way of doing things, and we have been doing these, what we call it as a full arch implants or a full mouth implants for over 20-30 years. But all-on-4 is kind of a concept. What that means is, your dentist is telling you, hey, your front teeth have gone bad also, and you have back teeth is missing. So instead of just restoring the back teeth, and you have compromised front teeth also, you pretty much remove those compromised front teeth also, completely restore them. But when you are restoring them, there are a couple of ways you can do this, and one of the ways is like here. You put individual implants, or like but 2 implants and a bridge, and you got 6 to 8 implants that you put in. And the other newer way of doing that is what we call it as an all-on-4. For example, you see here there are 3 implants on this side, 3 implants on that side to completely restore the arch. Instead, what you do is you put 4 implants. So pretty much the whole set of teeth being restored with the 4 implants, That's what it's called an all-on four. Nowadays, now another fancy word has come up. We call it as an all-on X. So sometimes the patients may not be suitable for an all-on four procedure. So either we may do it on 5 implants, 6 implants, or 8 implants. So talk to your dentist again. All-on four is a great choice, or it may become an all-on X depending on what you are going to need.
Absolutely. And in regards to that, are you able to compare it into like just getting a traditional denture?
Absolutely. Thank you. That was a great question. So what Shai is asking is how is this compared to a traditional denture? So traditional denture is like this. See here? It comes in and out.
Right.
So, we call it in our office as a grandma type denture. You know what grandmas do. So they don't put the teeth in their mouth because they don't fit. So they sit in the bottle by their bed. So you don't want that to be happen. Everybody want to have like a good quality of life. So when it comes to good quality of life, two options that we recommend patients do in our office. One is what we call it as a all-on 4 or an all-on X, where you don't have to remove the teeth at all. They stay permanently in your mouth. The second option, if you think that this is not affordable, you're not able to fit this into your budget, the other option we do is what we call it as a snap-on here. See here? It's like a button. I don't know whether you guys hear the click or not, like this. So you're going to be able to get a snap-on teeth. So again, talk to your dentist, or if you happen to be in the Dallas-Fort Worth area, come see us here. Thank you.
Absolutely. And how about we take a question from a viewer?
Oh, sure.
Yeah,
we got some
do
live
it.
questions?
We have some live questions.
Oh, great.
Absolutely. So the first one that I see here is, hi doc, after a root canal treatment on my front teeth, is it necessary to get a full crown, or would a veneer be sufficient?
So after a root canal, we always recommend, right, a crown for a tooth. But for front teeth, because it is not going to be a chewing tooth unless you are doing some crazy stuff like opening a beer bottle or like you're constantly biting something with your front teeth. It is not recommended that you need to get a crown unless you're concerned about like you want to do some cosmetic treatment, or you're noticing to very early notice of a change of color on your front teeth. You may want to consider a veneer, but very rarely, if the tooth has completely gone dark and then if a veneer is not possible, then we may recommend a complete or a full crown for that tooth. So to answer your question, for front teeth, a veneer or a crown is not necessary unless you are cosmetically concerned, or you're starting to notice either the tooth is getting really brown, or tooth is getting to get rotten, or you needed to have a root canal for that tooth, and the damage is to the degree that the damage is going to dictate either you're going to need a veneer or a crown.
Absolutely. Okay. Very good. We'll definitely come back to the live viewers, but we'll get back into some of the questions that were sent in to us. I'm 35 years old, and my dentist has diagnosed me with gum disease and recommended the extraction of 4 teeth. However, I don't feel any mobility in my teeth. How does a dentist determine whether a tooth is needing to be removed, especially if there isn't any noticeable movement?
So there are multiple things that we are looking at when it comes to removing a tooth. The first thing is we are looking at is on the affected tooth. We are looking at the severity of the gum disease, the level of bone loss, the level of infection, and the inflammation. And we also looking at, when we talk about the bone loss and the gum loss, we are also measuring what we call it as a periodontal pocket, or the gum pocket around the tooth. So we are measuring the pocket, and then the most important thing that we look at is how is that affecting the tooth, the adjacent tooth, or the adjacent tooth in the front as well as in the back. For example, if you have 2 teeth like this, and then if you have a middle tooth, And when you have bone loss going all the way, cupping like this, it's affecting the health of the tooth in the front, and it is affecting the health of the tooth in the back. For example, here, right here, look at that. So when you have a tooth in the back and tooth in the front, when you have bone loss all the way down, it is going to affect the tooth in the back as well as affect the tooth in the front. So you do not want that to happen. So that's why we recommend extraction to be done preventatively, so it doesn't affect the other teeth. So to answer your question, so your dentist may not be noticing any type of mobility, but they are recommending the tooth to be removed for that reason. Either the tooth cannot be salvaged with any type of periodontal gum treatment or a bone graft treatment, or it is starting to affect the two teeth on either side or one tooth on the side, and that's one of the reasons why they may be recommending.
Absolutely. Very good. I have bridges on both sides of my mandible for the past 4 years. You've been studying. And I was recently diagnosed with prediabetes. Since I'm more prone to gum disease now, will this affect my bridge as well? What extra precautions should I take to prevent any damage to them?
So, just because you have diabetes, that doesn't mean that you're going to be prone for any type of gum damage. Just because you have a bridge, that doesn't mean that you're going to be prone for gum damage. First thing, your diabetes, your bridges, right? And as long as you're able to keep your bridge as clean as possible and with the best possible tools that your dentist or your hygienist is recommending, you're as close to normal. Of course, there is a bit of a risk that if you're not able to keep underneath the bridge, then you may not be able to keep it clean. You are at a higher risk, but for the most part, you may be okay. But coming back to the diabetes, and we normally say this, people have a tendency to think, oh, I'm diabetic and I'm more prone to gum disease. Oh, I have high blood pressure, I'm more prone. Oh, my mom and dad had gum disease and I'm more prone. And of course, there is a small risk there, but it depends on how good of a lifestyle that you lead, how good you brush your teeth, and how good you floss your teeth, and how well you go back and see ToothHQ, the
That's
dentist,
right?
right?
Yes.
Yeah. How well you come to see us, and all depends on that, whether you're going to be at a risk or not. So don't be concerned just because you have diabetes. Don't be concerned you have a bridge. So keep going and keep doing whatever you're doing, brushing, flossing, whatever other tools, and see the dentist, and you're not in any more risk at all compared to any other person.
Perfect. I'm considering laser gum whitening and would like to know what laser treatments are usually covered by dental insurance. Is gum whitening typically covered, and will insurance cover multiple sessions if needed?
So what this person is referring to is gum whitening. A lot of people nowadays, this has become popular, and we have started whitening the gum tissue, particularly in some ethnic people. They have the gum tissue has a tendency to be like darker pink or like completely dark, and then when they are smiling and they are self-conscious now, they don't want to show. And nowadays we are in the selfie world, right?
Yes.
Yeah.
Cosmetics.
Right. Cosmetic, and then so we don't want to be. We are cognizant of when we are taking pictures, and then we don't want to show the black gums or the blackish pink gums. So we are doing a lot of the gum whitening. So what we are doing is we are using the laser machine to remove the dark pigmentation, almost like a surfacing of the skin. Dermabrasion, we call it as in the cosmetic world. So we are doing some depigmentation of the gum. So to answer your question, most of the insurances may or may not cover. But if you happen to be in a dental office, ask them whether the insurance is going to cover that specific procedure. And to expand on your question, the procedure may need to be repeated, maybe once or twice, and then we can try and see whether they can be considered as a medical necessity. More than likely, the insurance may not consider it as a medical necessity. And again, check with your dentist or the insurance provider to see whether it can be covered by the insurance or not.
Absolutely. Definitely look into your benefits. The next viewer that sent something in for us said, I had a root canal 20 years ago on my upper first molar, which has a cap. A recent cavity next to it required a new root canal and cap. My dentist now suggests a joint cap for both teeth. Is it better to go with a joint cap or individual caps?
Um, we normally recommend not joining the two teeth unless if it is a bridge situation. So what a bridge means, like you have a tooth in the back and then you have a tooth in the front, you have a missing spot in the middle, and now you're joining the two teeth, and so joining the two teeth together and put the bridge together in between, that is considered kind of a standard of treatment. And I'm not sure like what is going on in your situation, why the dentist is recommending, particularly if you are having what we call it as a mobility or some kind of a teeth, like the teeth are mobile, and you may start to have some bone loss or some unexplained mobility because of your bite that is happening. And that is one of the reasons why your dentist may be recommending that they need to connect the two teeth together. So if they are wanting to do it for sure, then my recommendation, one of the main reasons why the teeth get mobile, and particularly a good tooth getting mobile, is because of either the opposing tooth, or it may be related to because of some kind of a grinding or a clenching habit that you may have, and that needs to be corrected along with that or prior to connecting the two teeth to see whether it goes away. If it goes away, and just by correcting the source of the problem, which is because of your bite or because of your clenching or grinding, then connecting the two teeth is not recommended, or it is not something that I would recommend. You keep the teeth individual crown. It's easier to floss in between. Otherwise, when you connect them together, you can't really floss in between. So again, talk to your dentist and then see what the condition of the teeth are, and which is as making your dentist think that the teeth need to be connected, and they should be able to help you.
Perfect. Absolutely. So, how about we take a look at what our live audience is asking?
Okay.
All right. So, is it okay to use mouthwash the same day when you get a dental crown procedure?
Absolutely, it is okay to use a mouthwash after the crown procedure, same day or immediately after. And you're not going to do any damage by using a mouthwash as soon as after the procedure, crown procedure, or any type of dental procedure. What do we do in our office? You tell me about the mouthwash.
We actually send you home with one every
Then go.
procedure.
For every procedure. Can you repeat that again?
Every procedure.
Yeah, so every procedure that you come in for, we recommend that you go home with this antibiotic mouthwash that you go home with. So that is exactly what we are going to send you home with. So if you are concerned that if you are going to do any type of damage, which you are not going to, but even if you are, so what I normally recommend, particularly after a surgical procedure, and there is a lot of blood involved, as you guys know, blood when we do surgery, when particularly imagine like having a tooth removed, and you want to have a blood clot and that's sitting in there, and you don't want to rinse it away and get what we call as a dry socket. So which is one of the most common things people are very, very concerned of, or even fearful of, I should say, right? So what I normally recommend is you take the mouthwash and then kind of soak and hold it. So hold it and soak it and hold it for like about 30 seconds or to up to a minute or even 2 minutes. The way the mouthwash works, like it just kind of sticky onto the gum tissue or sticky to the teeth, and that's the way it works. So going back to your question, so using a mouthwash as soon as after any dental procedures, fillings, cavities, or crowns, or even dental surgery, absolutely not a problem at all.
Alrighty, very good. My 6-year-old son recently lost his lower front teeth, and the new teeth look yellow. Is this normal, or could it indicate deficiency or other issues? Thank you.
So having a teeth that are discolored or particularly yellowish looking, it could be to a variety of reasons. It could be just a normal color variation. It could be the genetics, or it could be related to like the structure of the tooth. The teeth have a lot of layers on them, and we got the nerve, and then we got the cement, the dentin, and then the enamel. Either your enamel may be a little white depending on which part of the world or which part of the country you are in, and what kind of a fluoride content that you may have in the water, so that may change the color of the teeth. And just because they are starting to look a little bit yellow, there is no immediate cause for concern. And once they start to develop, and then if you start to see like something changing, then my recommendation is you talk to the dentist. And particularly if you are starting to see this happening, and you need to be seeing a dentist every 6 months anyway when your son is growing up, and so now you even have a better reason to make sure that your son is getting to the dentist every 6 months. So talk to your dentist, and in particularly if the kid is a kid, and take them to a pediatric dentist. And then between the time that you are going to see a dentist or the pediatric dentist, keep a very good oral hygiene. So if there is related to like maybe it's because of the plaque buildup which is causing the teeth to look yellow, then you definitely don't want to be doing that. So keep a good oral hygiene. So multiple things you should be doing. Yeah.
Absolutely. Teach them while they're young.
Mm-hmm.
Alrighty. Hello, Dr. V. I noticed laser gum treatments are becoming popular as an alternative to traditional surgery. Are there studies showing laser are more common, are more effective, especially in healing time, success rate, or long-term outcomes? Appreciate your expert opinion on this.
So the laser treatment is definitely the laser treatment definitely is a more common thing. It is a more common thing for any treatment, a multiple gum treatment, or multiple oral surgical treatment, or multiple dental treatment. It is becoming very, very common. So you may have heard like one of the recent continuing education seminars. We were talking, and we were talking about Mozambique, right?
Oh,
so
we were.
people are looking for shortcuts, right? So one of the things that people say again.
And people.
Yes, correct. Yeah. So we are looking for shortcuts, and you may, if you are continuously watching the show, we talked about people. We ask them to brush and floss their teeth, and of course people cheat, right? And we all have our cheating moments, and so we cheat on eating food, or like whatever that we're cheating on, exercise, not exercising well, and which I do, by the way, right? And then so people may be doing other things, right? So what you want to do is to be able to brush and floss and keep your gums healthy and going back to the dentist. But when you are not able to do all of those things, and if you are looking for a little bit of a shortcut and little bit of a modernized treatment or modern way of doing treatment to the gum problem or the teeth problem, laser is the way to go. Which is why it is becoming popular. So either cavities or the laser gum whitening, or laser teeth whitening, or laser surgery, laser gum treatment. So many treatment is getting popular, and it is not uncommon at all.
And we have laser treatments here.
Absolutely. Multiple laser treatments.
Yeah, more than one. Absolutely. Wonderful. Hello, Dr. Vadivel. We have another one about a child. My 10-year-old daughter has lost most of her primary teeth. Is it safe for her to use an electric toothbrush or start flossing?
Absolutely. So kids love the electric toothbrush, by the way, the motorized toothbrush. And so my son was, when I think he was 2 years old, and we gave him a Superman toothbrush, and he got so excited. Now he wants to get all the what do you call that? Marvel theme, right?
Avengers.
Avengers and all of that good stuff, right? So for the girls, right? Whatever Barbie or whatever they want, right? So you can get them all excited by giving them the electric toothbrush of their choice, and multiple characters are available, you can get them. And then one of the best thing is, and some of these gadgets, they have some of these toothbrushes, they have a smartphone app attached to them. So if your kids, which most of the kids are nowadays, and they are born with the smartphone, by the way, right? And so when they really love the smartphone, and one of the ways they could be monitoring or you could be teaching them is how well they are brushing by putting them on the app and then showing them what the app is doing. And I have a couple of patients, they tell me, oh, my kid likes to watch this, I think what is that, sharks thing, some shark video.
Baby Shark.
Baby shark, right. Baby shark toothbrushing video, and then that's the way she brushes her teeth. So there are multiple ways, you can get them excited. To the answer to your question is absolutely, electric toothbrushes are great. That's not a problem at all. Particularly if your kid is using it, and depending on how well the kid is able to cope up with it, and maybe just supervise them to make sure that they're using it properly. Yeah.
Absolutely. So before the night ends, we definitely want to reach out and interact with our live audience. So I'll take another question. How does that
Great.
sound?
Mm-hmm.
All right. What's the best over-the-counter mouth guard for nighttime jaw clenching?
This is one of the most common questions that we have. I know I'm smiling here because we all want to have an easy way out, and the least expensive way out. And you can buy a night guard for as low as like about 99 cents from Amazon or eBay, which is not the one that I recommend. And we actually keep this mouth guard, and I'm looking at my inventory here. I don't have that. Somebody stole it.
Probably.
Yeah, right. Okay. So the mouth guard, that what I'm talking about, is completely, it goes all the way down into the gum. And what happens is, when you grind and clench your teeth together, then it is constantly moving between the top and the bottom teeth, and then it is constantly moving one side to the other. So it is going to rub on the gum tissue, and it is going to peel the gum away. So then it becomes, you bought a 99 cents mouth guard, but you cost an expensive venture. Now you are going to need multiple thousands worth of treatment to be done because of the damage that you created to the gums. And guess what? When you start clenching or grinding with putting something inside your mouth, when your mouth now starts to think that you have like a not properly fitting foreign body, now you're starting to clench or grind your teeth even more than what you're supposed to. Without the night guard in the mouth, now you're going to end up causing some irreversible damage you cannot reverse at all on the jaw joint. So for that reason, we do not recommend getting an over-the-counter absolutely at all. What we recommend is a custom fitting. This is the one that custom fits. What we normally do is we take measurements as dentists. When you come in, we take measurements of your top and the bottom, and then when you bite teeth together, how well the teeth come together. So we take measurements of all of that. And nowadays, we used to take them with the impression material. You probably have seen the gooey stuff that goes in the mouth. Nowadays, most of the dentists, as like we have all intraoral scanners, and so we scan your entire mouth, and then you scan your bite, and then we send it to the lab, and we make it. Or sometime with the technology that we even have printers, the 3D printers. We can mill them in-house, and then we can deliver them to you. So that's what we recommend. That's what we call it as a custom night guard. It looks like a proper fitting thin one like this, and I highly recommend you talk to your dentist about that.
Absolutely. Customizations are the way. Alrighty, so back to our sent-in questions. I'm 16 and drink carbonated beverages daily. How do these drinks impact my teeth and gums?
So multiple ways the carbonated drinks or the beverages affect your teeth. One, it is going to erode your teeth, what we call it as an enamel erosion, because they're just going to constantly, the acid from that is going to completely erode your teeth. And then because it erodes your teeth, now your teeth are going to have some kind of a cavitation they are going to have. Now, because of that, your teeth are going to become sensitive to either hot or cold, even sweet. And because now it is not polished anymore, the teeth are supposed to be. Now, imagine like, your, this is a great video that there is to watch, like on YouTube actually. Take a Coke and then pour it, or any soda, and pour it on your battery, right? You're going to see like that's the way some people clean their battery, or the acid on the battery, right? That's the same way it is going to take all the complete erosion away by pouring on it the same way. Your teeth are going to completely melt away and erode by having that acid. So now because of that, then you're going to have a lot of plaque buildup. Plaque buildup is going to cause cavities. So it's kind of a continuous process. So preventing erosion of the teeth and preventing sensitivity and preventing plaque buildup, keeping your gums healthy. So do not use any type of carbonated beverages at all, is my recommendation. Some people ask me one more thing. Oh, can I use the zero sugar, right? Zero sugar or not, it doesn't matter. It still have the acid in it, so you really can't get away with it.
Absolutely. Okay. Are the screenings for mouth cancer like other cancer screenings? If so, how often should they be done, and which specialist should I see?
So great question, by the way, great question. So one of the things that we do as dentists, and anytime you come in for your routine care to our dental office, either it could be like an exam or like a regular cleaning visit, we always do an oral cancer screening. So we don't just call it as an exam, we call it as a or a consultation. Either it is an exam and an oral cancer screening, or a consultation and an oral cancer screening. And we do a variety of things, and sometimes patients may not be able to appreciate that because we do that real quick. So when we are doing it when we are seeing any type of patient, what we are looking at is, we are not just looking at the teeth or the gums, and we are looking at whether they have cancer inside the mouth or whether they have cancer outside the mouth. Either the cancer inside the mouth, we call it as an intraoral cancer, or intraoral cancer risk, or extraoral cancer, and also we are looking at the jaw joint. So these are the variety of things that we do. And to answer your question, how often it needs to be done, it needs to be done as often it needs to be done. So sometime it could be as low as 3 months, or it could be 6 months, or you're the judge of your own person, right? Just like I normally tell this to patient, particularly if you're a high risk person, just like women are so educated to feel their breast and make sure that they are not feeling any lump on their breast. The same way, look around in your mouth, look around your face to make sure that nothing has changed from the day previous to today, or week previous to this week. And then if there is any change, talk to the dentist. And we got a lot of patients, they walk in, they are self-aware. Hey doc, things have changed from last week to this week, can you look at it? And I have an ulcer that has not been healing for over 2 weeks, and then we immediately recommend doing a biopsy, meaning take a sample of that. So to answer your question, it has to be done as often as you could, or needs to be done.
Absolutely. Definitely. Okay. Hi, Doc. I'm 35. I had a root canal on 2 front teeth 10 years ago, but a boil developed above one tooth 5 years ago. Surgery helped, but the symptoms are back. My dentist now suggests removing the teeth and getting a bridge, since implants aren't possible due to insufficient bone. I'm unsure why my root canal failed, and concerned about damaging adjacent teeth for the bridge.
So, this is a two-part question. So you have a failing tooth, and you want to know why the root canal failed. And then the second part of the question is, if the root canal is failing, the tooth needs to be removed. Why can't we do an implant, as opposed to then why is the dentist recommending a bridge? So the root canals fail for a variety of reasons. It could be because of you may not be the right candidate for doing the root canal, but the dentist wanted to try their best to help you keep your tooth, and that is one of the reasons they did the root canal. Now, root canals are not fail safe or like foolproof, and sometimes I see a dentist even say that, oh, if root canals are like taking time bombs, and you never know when they are going to explode. So it may be one of those situations. Then the dentist may not have been able to predict how long the teeth are going to last, and we can't do that anyway to for every single case, or any case, I would say. So that is one of the reasons the root canal is failing, because you got some reinfection. To answer your second part of the question is why you are not able to get dental implant. Very rarely, as surgeons, as we do here, we die hard to not touch the adjacent teeth, the two teeth on either side. Whenever we are extracting a tooth, or we are very careful about preserving the bone, not only able to preserve the bone, we are adding additional bone, particularly in bone loss situation. Sometimes we are able to place even implants at the same time as we are extracting the tooth, and those are some of the ways that we are able to prevent from grinding the two teeth on either side, and able to successfully give patients what is the best and the modern treatment, which we, in our opinion, as surgeons or implant specialists, we consider implant treatment as the best option. So definitely talk to your dentist, and whichever part of the world you are, or whichever part of the country you are, why they are not able to recommend an implant, and ask them, have a honest conversation. Hey, Mr. Dentist, and I understand that you are not able to do an implant. Hey, can I go a specialist, and is there an option for me to go see a specialist? And I see you smiling, and if you happen to be in Dallas, come see us, and we definitely can help you. So but absolutely, if it is not possible at all, your surgeon agrees or your dentist agrees, bridge is definitely an option, and talk to your dentist, and they should be able to help you.
Wonderful. That actually brings our night to an end. That was a very great, expensive question.
And thank you very much, all. We will see you next time.
Thank you.